Milwaukee County Aging and Disability Services is really a one-stop shop for individuals with disabilities, older adults, and the people who care for them. We are intended as a place to get resources, but also a place where advocates, allies, members of those communities are able to work toward innovation and new ways to ensure high quality of life.
So Milwaukee County Aging and Disability Services is like a huge umbrella. It's the gateway to a lot of services. If you need long-term care, if you're caring for someone with dementia, or if someone needs to be connected to disability services, there's just so many things that we can bridge the gap.
As a dementia care specialist, I really focus on serving those who are living with dementia and their family members and caregivers. There's two big needs that I'm seeing in our community around dementia. One is there's just really a lack of education about what is dementia. There's a lot of misunderstanding about what the disease actually is, how to best support somebody living with dementia. And then two is lack of affordable and skilled caregivers to help the families who are caring for this person and the people living with dementia.
What we often are addressing is the strain that dementia places on families and informal support networks. And so one of our main objectives is to enter homes, be there for caregivers, provide strategies for them. And it is a progressive disease, so it's wonderful when we can enter the picture early enough to connect them with caregiver training, with resources in their home, with external supports, so that as things progress, we've already entered with the support that caregiver is going to need.
There's a couple ways I am looking to integrate the Dementia Values and Priorities Tool into the work that I do. The first way is in my individual consultations with families. So when I'm sitting down with the person themselves living with dementia and their caregivers, I am providing them the education that this is a tool that's available. The second way is I am providing a lot of education to the community around this tool. So hosting presentations and also going to outreach events as well.
I believe using the dementia tool will help me when I go into homes and there are people who are in earlier stages of dementia who are able to answer these questions, to really look at, as this progresses, what is it that you want for your life and for yourself.
The tool is it's a strategy to help people have conversations that none of us want to have, but we know the value of planning ahead, particularly with someone with dementia, because if we can capture that moment when they can still share with their loved one their wishes, their priorities, we're giving them a true gift for the future and for some of the things that are to come.
A way of upholding our control and dignity, which are values that are important to all of us, is to really plan ahead and think about what we would like to have happen with our healthcare. Anytime we can have an opportunity to do that before a crisis occurs, we really are able to make the choices that align with our personal values.
When you care for your family and you care for your loved ones around you, one of the most beautiful gifts you can give them towards the end of your life is to help them understand your own wishes, to help them understand how you want to be cared for and how they can support you on this journey.